Well, do you want to look younger? Who doesn't? Bellafill is taking the beauty industry by storm. And with us this morning is dermatologist Dr. Rebecca Kazin. She's going to tell us all about this filler and how it can make you look and feel your best. Let's start with, thank you for being here, first of all. And let's start with what is Bellafill for people that aren't familiar with it.
Right. So Bellafill, first of all, is a filler, which is different than the Botox variety of treatments. Those treatments decrease lines by relaxing muscle. Fillers in general treat lines by filling them in and pulling in water and providing structural support, and that's what Bellafill is.
So what makes Bellafill different and the best? Right.
I mean, there are a lot of fillers out there, and in fact, we use all of them, but just in different ways. But Bellafill really fills a niche because it's the only FDA-approved filler right now for acne scar treatment, meaning the depressed or what we call atrophic acne scars.
Right.
And what's also great about it is it has 5-year safety data.
So there's some research that's backed it up. For people that are going through the acne scars and wanting to get that treated, what's the process like? How long does it take for it to happen?
Right. So we're finding that once the acne is gone, people are living with acne scars, and it tends to become more obvious with time because we lose volume from our face. Everyone does. And what happens is the skin starts to buckle where the acne scars are, and they actually become more noticeable as you get older. And this is in men and women. And in the past, we've been limited to basically resurfacing treatments, which kind of sand them down, but sometimes can't fully treat the process. And so in the past, we've tried fillers, which do work to kind of lift them from below, but this is something that had to be repeated multiple times, whereas Bellafill has a 5-year duration, which is about 5 times longer than what's on the market.
So is it one treatment? You come in?
So it's interesting. I don't want to overcorrect and then create a bump. So what I generally tell patients is a series of 1 to 3 treatments spaced about 4 to 6 weeks apart, but limited healing time. I mean, they can go back to work the next day.
What if someone's watching right now and they're saying, you know what, I don't know, I would like to do this, but I don't know if I can afford this. This seems like something that I wouldn't be able to do.
You'd be surprised. Filler can actually be pretty economical, especially if you compare it to laser resurfacing. And we can do small amounts in focal areas that can make a definite difference. You can at least discuss the area that bothers the patient the most, start there, and then work with that.
What kind of age, who does this work for?
It actually works for really everyone, but I would say that the younger you are when you start, the better, because your collagen is more active and you have more innate structural support, so the filler actually can last longer. But we see patients well into their mid-70s.
And now, what do you see from the patients, the before and after? What are their reactions when they've had this?
It's really rewarding, I have to say. You know, people always joke about dermatologists treating acne and things like that. But my acne patients are some of my patients with real self-esteem issues, and then again, now they have the scarring, and so everyone knows that they had acne, and now they have the scarring. And so what's amazing about Bellafill is it's immediate. So they look in the mirror right when I'm doing the treatment, and they see the improvements. Right. It's amazing.
Oh, that's awesome. And we were looking at some other pictures a moment ago of wrinkles as well, which is a big thing as we get older. It's like, I don't want these on my...
I know.
Nobody wants that.
Right. I mean, it's interesting. Some wrinkles, people joke that they've earned, but there are some on people's faces that they look in the mirror and they say, you know what, that's just not me. I look tired or I look angry. Bellafill is FDA approved for these lines, and that's where it has its 5-year duration as far as studies. But as physicians, we're able to use it off-label in other areas, and so we're able to use it pretty much anywhere on the face that we feel that the patient is losing volume and looking older. So anybody that's basically gone like this and felt like they look a little better, that's for you. Okay, good.
Hey, so if people have been watching, they've connected with you today, and they say, all right, what's the next step? How do I get started?
So we're one of the only dermatology practices in Maryland, D.C., and Virginia that are offering this treatment because we are true experts in filler. So I would have them either call our office in D.C. or Chevy Chase or go on our website.
And come in for a consultation.
And come in for a consult.
Just see if it's, start there.
Exactly. I think that what makes us different is that we tailor the program to you. Maybe it's a little filler with resurfacing. Maybe it's a different product altogether.
Sure.
But get an evaluation.
All right. For more information on Bellafill, visit bellafill.com and be sure to schedule a consultation with Dr. Kazin by calling 240-394-8385. Thank you for coming in, Doctor, and educating us about this. It's been great. Thanks. More of Let's Talk Live in just a moment.